Lip filler on our wonderful patient today. Fiona volunteered to be our video patient today. What we start out with is we block everyone's lips first, because then we use a blunt needle to minimize the risk of embolisms. So remember, a lot of people do sharp needle injections for lip filler. And the problem with the sharp needle is it can go in a blood vessel and you get one of the really scary things where people's noses end up dying because they're not getting blood supply and that kind of stuff. So in order to not have that risk, we use blunt needles, which I'll show you in a sec, but we're going to start out by blocking her first. We do 4 little injections, 2 in the upper, 2 in the lower, and then she'll be numb after about 10 minutes. So we're going to go ahead and put Fiona's head back a little bit. So these are the new Juvederm syringes. They're easier to use, a little bit better handle, but now you guys can take a look closely. You can see the difference between a blunt and a sharp needle. The hole is on the side. So actually when it goes in, it doesn't cut. So it can't enter into blood vessels and cause embolism. So that's a good thing, that's what we want. And then basically what we're gonna do is, instead of coming and doing multiple little pokes, we come from the corners and then we're gonna come across her lip, and that way we can fill in little pearls. That way you avoid the clumps that can cause problems, and we do little pearls that will look a little bit better. There's less chance of people having the biorefringence that people talk about, where you see little blue globs. Make a hole first. So this is a sharp needle. So we test first. Are you okay there? Good. We make a tiny little hole. And then we're gonna come in with now our blunt needle. We find that little hole and we just go back in the same place. And then you can see the needle coming across to where we want it to go. So this way we can guide it. The anatomy of the lip is important. The tip should always have a little bit more fullness, especially on the upper lip. So we're going to come to the center, you guys can see, and we're going to fill a little bit there first. So we're going to create a little bit of that extra bulbous tip. And then it should be full, depression, and then fullness here. And then the bottom lips should fill those depressions. So the fullness here should have a depression below, which it does, and then fullness here, which fills this depression, and then it evens out. So you see the difference now between one side and the other?
Yeah.
Okay, that's what we want. Full, depression, full. So now we're going to do the other side. We're going to fill here more centrally and there. Leave the depression and full.